Good morning everyone. Today's topic of dissection is superior and inferior mesenteric arteries. Now we talk about the superior mesenteric artery. First of all, this is the artery of midgut. Now its origin is it arises from the front of the abdominal aorta. This is abdominal aorta behind the body of pancreas. This is the body of pancreas. Behind the body of pancreas near its neck at the level of L1 vertebrae, about half an inch or approximate 1.25 centimeter below the origin of celiac trunk, and this is the celiac trunk. Courses, it runs downwards to the right, forming a curve with its concavity towards the left. From its origin, it lies first behind the body of pancreas. This is body of pancreas, and then in front of the uncinate process. This is the uncinate process. Next, crosses the third part of duodenum. This is the duodenum. It crosses the third part of duodenum and enters root of mesentery. These are the root of mesentery and runs between the two layers of it. Termination. Now it's terminate in the right iliac fossa. This is the right side of iliac fossa by anastomosing with a branch of Iliocolic Artery. Throughout its course, superior mesenteric artery is accompanied by superior mesenteric vein on its right side. Now it supplies lower part of duodenum. This is the lower part of duodenum, jejunum, the ileum, the appendix. This is the appendix, and this is the cecum. This is the right 2/3 of transverse colon, lower half of head of pancreas, and this is the head of pancreas. Relations, there are two type of relations: anterior relations and posterior relations. In anterior relations, about downward, body of pancreas, this is body of pancreas to the splenic vein, and these are the splenic veins. Posteriorly to the aorta, this is the aorta, left renal vein, the uncinate process, and the last one is third part of duodenum. Now let's talk about the branches. Basically it gives 5 set of branches, both from its right and the left sides. Those whose arising from the right side are: the first is inferior pancreatoduodenal, second is middle colic, third is right colic, and fourth is iliocolic, and the last one is arising from the left side is 12 to 15 jejunal-ileal branches. The first one is inferior pancreatoduodenal artery. This is, this is the inferior pancreatoduodenal artery. Here we can see arises from the superior mesenteric artery at the upper border of third part of duodenum. This is the duodenum, upper part of third part of, this is the third part of duodenum, and it's directly divided into two branches. Here is one and here is second one. These are the anterior branches and the posterior branches. These are run in pancreatoduodenal grooves and supplies the head of the pancreas and the duodenum. The second one is middle colic artery. This one is the middle colic artery. Arises from right side of superior mesenteric artery from below the pancreas. This is the pancreas, below the pancreas. Runs downwards, forwards in transverse mesencolon. Right branches and the left branches. It gives right branches and the left branches. Supplies the transverse mesencolon. The third one is right colic artery. This one is the right colic artery. Arises near the middle of concavity. This is the middle of concavity of superior mesenteric artery. Passes right behind the peritoneum at the upper part of ascending colon. This is the ascending colon, and divides into ascending and descending branches. Divides ascending and descending branches. These are the ascending branches and these are the descending branches. Small branches are distributed to the upper 2/3 of ascending and the right flexure of colon. This is the right flexure of colon. Last one is Iliocolic Artery. This one is Iliocolic Artery. Arises from right side of superior mesenteric artery. This is the right side. This is superior mesenteric artery and runs downward to the right. And it's divided into superior branches and the inferior branches. Both anastomous with the right colic artery and terminates to superior mesenteric artery. Now, jejunal and ilial branches. These are the 12 to 15 in number. Here we can see 12 to 15 in number. All are jejunal and ilial branches. Arises from the left side of superior mesenteric artery. Runs between the two layers of mesentery. Supplies most of the jejunum and the ilium. Now, superior mesenteric vein. This is the superior mesenteric vein. Large vein which drains blood from the small intestine, the appendix, the cecum, the ascending colon and the transverse colon. It begins in right iliac fossa. It begins in right iliac fossa by the union of tributaries from the ileocecal regions. Veins lies on the right side of superior mesenteric artery and it terminates behind the neck of pancreas. This is the neck of pancreas and joining the splenic vein to form the portal vein. Joining the splenic vein to form the portal vein. Now let's talk about the inferior mesenteric artery. Inferior mesenteric artery is the artery of hindgut. Basically origin. Inferior mesenteric artery arises from the front of abdominal aorta. This is inferior mesenteric artery. Behind the third part of duodenum. This is the duodenum. Behind the third part of duodenum. Level of third lumbar vertebra 3 to 4 cm above the bifurcation of aorta. This is the bifurcation of aorta and 3 to 4 cm above it. Now courses and terminations run downwards to the left behind the peritoneum. Behind the peritoneum crosses the common iliac artery. Common iliac artery medial to the left ureter. Continues in sigmoid mesocolon. Continues in sigmoid mesocolon as the superior rectal artery. Branches are inferior mesenteric artery gives off mainly 3 branches. Left colic artery. The second one is sigmoid arteries and third one is superior rectal artery. It supplies the left one third of transverse colon, descending colon, the sigmoid colon, the rectum and the upper part of anal canal and above the anal valves, which is not directly seen from the hair. First one is left colic artery. First branch of inferior mesenteric artery, the first branch runs upwards and to the left behind the peritoneum and of the posterior wall of the left infracolic compartment. Basically, it divides. The ascending branches goes to transverse mesocolon and anastomosis with the middle colic artery, and the descending branches anastomos with the highest sigmoid arteries. The second one is sigmoid arteries. These are the sigmoid arteries, 2 to 4 in number. Passes downwards to the left, anastomosis with the each other to form the lower part of marginal artery. Here we can appreciate anastomosis with each other. And the uppermost branch, descending branch of left colic artery and the lower sigmoid artery sends a branch to anastomosis with the superior rectal artery, supplies descending colon and the iliac fossa and the sigmoid colon. The third one is superior rectal artery. This one is the superior rectal artery. Superior rectal artery is the continuation of the inferior mesenteric artery beyond the root of the sigmoid mesocolon, and it descends into the sigmoid mesocolon to the reach to the rectum. Opposite to third sacral vertebra, it divides into the right branches and the left branches. Now, inferior mesenteric vein. This is the inferior mesenteric vein, drains blood from the rectum, anal canal, sigmoid canal and the descending colon. Longer than the artery, and superior rectal vein crosses the left common iliac vessels medial to the left ureter and continues upwards as the inferior mesenteric vein. Veins lies lateral to the artery, opens into splenic vein. This is all about the superior and inferior mesenteric veins. Thank you.